There was also a review of which kits are being used to monitor the light chains, because there are actually 3 kits that are currently available for measuring of the light chains. And it was pointed out by French investigators that these 3 measurement modalities were not interchangeable in terms of measuring and following patients with amyloid. The first introduced light chain assay is that produced by the binding site of Birmingham, England. Most of the investigators on the panel continue to use this, but are exploring alternate options for light chain measurement based on cost. There was an extensive discussion at the symposium about the role of stem cell transplantation in the management of amyloid, and it was agreed that the improved outcomes seen with stem cell transplantation were not merely a function of patient selection of those patients destined to do better. And as a consequence, stem cell transplantation for patients in whom the procedure is safe remains a strong recommendation of the panelists as part of the consolidation therapy of patients with light chain amyloidosis. But in order to do so, it should be done with an anticipated therapy-related mortality less than 3% in order to justify its use. The panelists emphasize that outcomes in amyloid transplant are often superior to the outcomes in myeloma stem cell transplant by virtue of the fact that the amyloid clones tend to have favorable genetics, tend to have a lower tumor mass than myeloma, and tend to have a lower proliferative rate, so that once a plateau or deep response is established, the likelihood of progression is much lower in patients with AL amyloidosis than in multiple myeloma. So transplant remains an important option. At this point in time, there were no trials open that the investigators were aware of using CAR T therapy as a modality for the management of amyloid, or with the anti-BCMA antibody belantamab, but they were optimistic that this is likely to occur. There's also the recommendation that venetoclax be strongly considered in the management of patients with amyloid, preferably in the context of a clinical trial, because venetoclax, which targets patients who have the 1114 translocation, produced very, very high response rates in small case series that have been published. Venetoclax being orally available and targeting BCL2, which is overexpressed in amyloid patients with translocation 1114, is an important therapeutic option. It should be noted that unlike multiple myeloma, where no more than 15% of patients actually have the 1114 translocation, in amyloidosis patients, nearly half of the patients have a translocation 1114. So the likelihood of finding patients that are going to benefit from venetoclax is almost 3 times higher in amyloid than it is in multiple myeloma.